All right, we're live.
Good morning. This is Senate Health and Welfare Committee. It is January 29th. And this morning we're going to be looking at childcare updates from DCF. And we have with us Commissioner Brown and others. And I'm going to turn it right over to you, Commissioner. Just to note that two of our members need to leave for a phone call at 9:30, but they'll be back. So we'll still have a quorum and we'll still look forward to your testimony. And I think you sent some information that we have on our webpage.
Yes, good morning. We did. We sent three documents to the committee, two PowerPoints, and then a one-page description of the 5-year plan. With me today, we have Miranda Gray, who is prepared to speak to the work of the hubs that we stood up in the fall in response to the pandemic and schools being remote or a hybrid of remote or in person. And I know you're taking testimony from Holly Morehouse later on that as well. Also, we have our Chief Financial Officer, Sarah Truckle, who texted me that she's having trouble joining on the Zoom link and she's restarting, but hopefully she's able to join in soon. And so my understanding is the committee kind of wanted an update of kind of the status of the childcare system, the update on where we are with implementing the 5-year plan, and then also the governor's proposal regarding the restructuring the Child Development Division. And we're prepared to speak to all three of those today. Is there a preference for the committee how we proceed?
I'll open that up to the committee. Which is there a preference for beginning at one or the other?
I think maybe bring the background stuff first. And
okay, if you look at the 5-year plan first and move on, but I think if we can make sure that we do get to the restructuring recommendations as well. I know we're going to have to have you come back for that, but at least to get us started.
Sure, absolutely. So what I'll do is
the background work, Senator Hardy said, is a good place to start.
I also is the stuff on the website, Nellie? I don't actually see it up there yet.
I'm working on getting it up right now, so it will be up shortly.
Okay.
And so, and Sarah can pull it up and watch. She'll walk us through the first piece of the status of the kind of the 5-year plan and where we are with implementing that plan. I believe she has joined us. Sarah, do you want to take it from here?
I'm happy to. I am actually just waiting for my computer to restart. I connected via my phone, but it isn't letting me into the Zoom meeting. So if you could just give me 1 second.
Okay.
We're very patient.
I apologize.
No, how can you apologize for technology? 25 years ago, we couldn't have been doing this at all. So
yeah. We did experience some network difficulty with the state network yesterday, at least on our end.
It was going on everywhere.
Okay.
We couldn't get in and access our web pages and things like that. So there was something going on with the whole network process.
All righty. Well, my computer has restarted, so that's a good sign. And I've got it up, so hopefully it'll let me into the meeting now and I can share my screen. Fingers crossed.
Nellie, did you give Sarah? Oh, there she is. Got it.
Okay. Had to leave one meeting and start another. Nellie, I'll need access to share my screen.
I just gave you access.
Perfect. Okay. Can everyone see my screen?
Yes, we can.
Perfect. So Sarah Truckle, DCF Financial Director for the record. The Child Care Financial Assistance Program pays tuition on behalf of eligible families directly to child care providers. to pay for their tuition payments or a portion of their tuition payments based on a income scale. So currently, as many of you know, we conduct a market rate survey, which determines the rates that providers are charging in the field. And then we have, over the last several years, increased the rate of CCFAP reimbursement. So in our 5-year plan, in the first year, we changed our income guidelines to 200% of the federal poverty level and increased our preschool and school age rates to the 2014 market rate survey. That was year 1. Last year was CCFAP year 2, where we increased preschool and school age rates again to the 2015 market rate survey with no increase to the income guidelines. Now we are in year 3, which we'll talk a little bit more about in our budget proposal, but what we're proposing is to implement the redesign of the program. And several years ago when we proposed this 5-year plan, the idea was to increase the rates and move us to this redesign in which we refer to as the flip of the system, which also brings us into compliance with our rates and our requirements for our Child Care Development Fund funding, which we receive from the federal government under the Child Care Development Block Grant. So the redesign, which is what we're in now, sets a flat copay amount for families based on family size and income. It's a family copay rather than a per child copay. It's assessed by that youngest child first with no additional amount needed per the additional children. It expands eligibility by increasing the income guidelines. It stops the benefit level based on a percentage of the state rate, and it pays providers reported rate on the age of the child and after the scheduled copay is assessed up to a capped rate. And the capped rate is determined using the 50th percentile of our 2019 market rate survey, which is our most current market rate survey. So right now, when we think of CCFAP rates, we think of the rate that the provider charges, we think of the rate that the state pays, and we think of the family copay that the state requires. So in a simple example, if a provider charges $200 per week and the state rate is only $150 a week for that provider, the family is making up that $50 difference in addition to making up any required copay based on their income guidelines. This redesign flips the system and then creates a family copay that is based on their income and eliminates the need to have the difference between the provider rate and the state rate or the copay that's associated with their income level on CCFAP. So it's a little bit complicated, but the new system is much more streamlined and easier for families. In year 4 and 5, we're not actually proposing any additional changes, but we anticipate that based on the flip that we're doing this year and the changes that we're making, that because we've increased the income guidelines and made shifts to the market rate, that the program will obviously right size with caseload and utilization, and that from our historical data trends, anytime we make a shift to the system, it takes between 1 and 2 years to really see that full impact of that shift on our caseload, on our families, on people coming into the system, and working through those pieces. So year 4 and 5 is really around the implementation and figuring out how all of that played out on the ground and seeing the impact to families in that expanded eligibility, as well as how the providers shift as well.
And as we work with families in that first and second year after the flip, and we assess the impact it's had on providers and families, we may come in with technical adjustments if there's things that need to be fixed, at that point. But I think we're going to have to do an assessment and work with our providers and our families just to understand how this change impacted them on its. We believe that this will lead to a reduction in out-of-pocket cost for families accessing childcare and provide a better rate structure for that. And so, we're pretty excited to buy this, but it is a big change.
I should add too that it also brings us into compliance, which one of the reasons that we did this plan with our federal requirements. And the plan is contingent on the first module of the new CDD information system, which is replacing the current BFIS system, that first module being completed. So the shift won't actually take place until the end of September with that corresponding payroll period in order to be compliant with the new system.
Will this system be integrated with the electronic eligibility determination system, the new system that's being put in place in AHS? Are you going to be, will it be fully integrated into the new IT program that we've been working on for other departments and programs?
So we are working right now, Senator, on rolling out the first module of the new Bright Futures information system, our child care system, which includes an eligibility component. And so that first module is scheduled to be completed in October 1st, so that we're able to implement this redesign and also come into compliance with federal requirements of our system, which we're not able to meet at this time, given the age and condition of our current IT system. So we are, this will be a part of that new system rollout, this rate redesign.
Okay. So I think it will be part of the new IT system. It sounds like it is.
Yes.
Yeah, okay. Good. Committee questions for Sarah at this point? So where are we so far? We are in year 3.
So last
Yeah.
year we implemented year 2.
Yeah.
And in the FY22 budget, you see a technical adjustment. If the committee may recall, we used one-time tobacco funding for that second year of implementation. And now in our FY22 proposal, we've moved that back to general fund and in the base. And then in this year's FY22 budget proposal, we are proposing to implement year 3.
Okay, so what's happened to the tobacco fund monies?
We used it for a one-time
Right.
and we have right-sized that in general fund this year in our proposed budget because it was
Okay.
only able to be used one time.
So now we do have some theoretically we have tobacco fund money that we can draw from for prevention, should we so desire to do that.
I am not the right person to tell you how much money is in the tobacco fund. I just knew
I
that.
know, I'm just making a comment. Okay.
Madam Chair, can I ask?
Yeah, go ahead, Ruth, go ahead.
Thank you. Sarah, thanks for this. I finally pulled it up on the website, so I couldn't quite see your slide with the your chart. So basically in this year, dropping from $293 per month down to $75 is because you flipped the copayment on its head and taken that off the top as a family copayment.
Yeah, so in this example, we're not only are we removing reducing the copay requirement under the CCFAP rate structure, but it's also relative to the provider rate. So sometimes providers charge more than the maximum amount under the child care financial assistance rate, so the cap state rate, which means that even though families receive child care financial assistance and tuition is paid on their behalf, it doesn't cover the full tuition that the private provider charges. And because it's a private system, then the family makes that up. In the new system, it's a copay that's only required, and there isn't that difference between the CCFAP rate and the provider rate because the rate is capped at the 50th percentile of the market rate system.
So you're capping the rates for providers. you're telling providers, if you're participating in this, you can't charge more than X dollars per month.
We've made that market rate based on the most recent survey at the 50th percentile.
Okay, and that was my question. Another question is it looks like it's based on 2015 market level. Oh, you said a 2019 market rate. Okay, so you're increasing the market rate that you're using as well. So providers aren't going to get the shaft. Is that? That's my word, not yours.
The market rate is increasing to the 50th percentile of the 2019. So that means that when we do the market rate survey, we survey the field, and depending, some providers will be on the upper end and some providers will be on the lower end. And we're saying our cap is going to be at the 50th percentile.
Okay. And is 2019 is the most recent? How frequently do you do that survey?
Every 2 years.
Every 2 years. Okay, great. Thank you.
Okay, any other questions? I'm trying to remember when we put the 2015 market rate in, was that 2 years ago or 3 years ago? When we passed legislation on that. Anyway, it doesn't matter. All right, committee questions. I'm sure we'll have more as we go along. So Sarah, thank you. It's very good. Sean, Sarah and Sean and Miranda, it's.
Sure. So I think the next we'll jump to is just the current state of the childcare system in response to COVID, and give you some data and overview of what we're seeing for trends in the system right now, and kind of what we've done in response to the pandemic to shore up the child care and learning, early child care and learning system. Sarah, I didn't know if you could pull up that PowerPoint. We can walk through that as we go.
Yes, happy to do so.
Sure.
Okay.
And so if you want to jump to the first slide, Sarah. So one here is we're just pulling up data on the current state of the childcare system in terms of providers and what we're seeing. Every year we do see providers leaving the system and new providers coming into the system. And I know there was a fear based on the pandemic and that it would have a large impact, negative impact on the childcare system. And then based on the investments, we think that's been minimized. As you can see here, overall, there's been about a 1% decline in the number of in the capacity of childcare in the state. However, it's not been a consistent pattern across the state. There's been certain areas of the state where we've seen greater impacts than others. I think the largest impact we've seen over a 15% decrease in the Newport area in terms of childcare capacity. Also, the second area where we've seen some impact is in Middlebury. We've seen about almost a 6% decrease in capacity. And then Montpelier, almost a 4%, and then Rutland 3.5%. And so, it's varied in different regions of the state, but overall, we have only lost, just about 1% of our child care capacity. Although I would say the pandemic's not over, and so we certainly understand that there's still tremendous pressure on the system, in families and the economy, and so there are ways that things could still change. But overall, the system as a whole has weathered the pandemic so far, although there's certain pockets of the state where it's had a greater impact than others.
Do you have a sense of why some of these areas have the greater loss for Newport or Middlebury? Is it because of the type of care facilities that are in those areas, or?
Yeah, I would say, like the Northeast Kingdom's been, prior to the pandemic, was always difficult for childcare providers, just given the rural nature and whatnot. And then Also, I think, some providers, when we've surveyed some providers to understand the impacts of the pandemic, of some of the closures we've seen, about 16% of them were directly related to the pandemic, is my memory. And so, providers, might have had, particularly home-based providers had underlying health conditions that really made it difficult for them to continue to stay open and maintain a childcare business, just given the risk to themselves or a family member that might be in the household as well. And then, and it's impacted other, certain providers more than others. Some providers have lost families who have chosen to keep their kids at home with them while they're in the pandemic. So it's really a mixture of the impacts across, how we've seen that sugar off in the system. There's been a multitude of reasons why some of our providers have closed at a greater rate than others.
So I guess it leads to the question, and I don't want to hold us up on this issue, but as you're going through, obviously the pandemic has really exposed gaps in the system. And so as you identify what some of the causes are for the losses and the gaps, I hope, have you identified any? That's all I'm saying as you go through all of this.
Yeah, I would say just one, the way the pandemic, the pandemic has been a major impact, in terms of just providers that aren't able to stay in just because of health concerns. And so that's one area that really led to some closures. I think the other are some providers experience a greater loss of enrollment, as we've seen families who have been able to telework and manage to keep their children at home with them have chosen to do that. And so some providers lost a significant number, and then based on that chose to close. And so we have provided, mechanisms and funding to try to support the system to stay open, but I think some experienced such a loss that it just wasn't financially viable for them to continue to stay open with the low enrollment numbers that they were experiencing. So I would say the pandemic, for those that have had the largest impact, is pandemic related for sure.
Thank you.
Yep.
I'll try not to interrupt.
Sorry,
Go ahead, Senator Hardy. Go.
Sean, or Commissioner, sorry. Just looking at the numbers, and I think that these are childcare slots, not programs, correct? So when you say capacity, it means the number of slots. So it's not like
Yes,
in the 66 private provider. We don't have 66 providers. So, okay. Yeah. That might be something you want to put on the chart just to make clear. But I think that the second point that you make is really important, that some of this was about family choices, that they were able to, or they made the choice to keep their kids home during the pandemic and not go to childcare. And we can debate whether that's a good thing or a bad thing, but I think it's important. And I think that was one of the driving factors in Middlebury. Our largest employers were all teleworking. And so a lot of families made the choice to keep their kids home, and their lives have been crazy because of it, but they've also not paid into childcare because of it as well. So that's, I know in my community, that's been a factor.
Yes.
Okay, go ahead, and we'll try
and so
to
we'll just
hold
move
some
to the
questions.
next slide. That just kind of shows the number of providers coming in, over time, just the trends. And it's just a point in time piece of data just for the committee's information. I think what we'd want to do is, I think the next area for us that's important to focus on for the committee is the next slide, which is really utilization in our subsidy program. Sarah, I didn't know if you could move us to the next slide. This is where I think you really see the impact of the pandemic on the system overall. We are seeing a decrease in utilization of the CCFAP, subsidy program. We're at 78% of what we saw in state fiscal year 20 for utilization, and we're at 75% of what we saw in what I would call the last normal year, because the pandemic hit in 20, but in state fiscal year 19, we're at 75% of what we saw for utilization. And that really bears out in that we have an underspend as a result of that of $4.8 million in the subsidy program, just because families are not availing themselves of childcare for the reasons we've already touched on, which are many families are choosing who have the ability to have their kids stay home with them and support them in that way instead of having them go to childcare providers. And I'll move on to the next slide, which I think highlights the work we've done since the start of the pandemic in terms of trying to make sure that we made sure the childcare systems was available and throughout the pandemic and didn't suffer a large retraction and was there to support the economy as we recovered from the pandemic. And so early on in mid-March to late May, we ran the childcare business stabilization program, which is just under $8.5 million provided to providers. Also, during that same time period, we ran the essential person childcare and incentive program, about $5.7 million investment in the childcare system. And then also, as we started opening up after the closure period in the late spring, we provided restart stipends to providers, just $6.6 million that opened throughout as we started to reopen. We provided these stipends to providers to meet the needs of increased cost of purchasing PPE and cleaning supplies and other things they needed to reopen. And so that ran through this last summer. And then also we provided the relief grant program, which went to a multitude of providers as well, but these dollars are just those that went to the child care centers. So just over $11 million, and those went for a variety of cost. It could have been for staffing, it could have been for building modifications, new equipment to in response to the pandemic. It really provided some flexibility for providers to meet their unique needs as they continue to maintain a childcare business. And we feel like this program was really successful as well. And then also, as we work to stand up the hub system, we received funding not only to help fund the hubs and their startup cost, but we also made those eligible for children that were CCFAP eligible to access the subsidy program to help pay for that care. And so there was $3.8 million in subsidy payments that went to support families accessing, the hub programs for kids when their schools were closed and they needed a place to go to help online learning. Also, we had providers access the hazard pay program that was run by the Department of Financial Regulation. Based on our calculations, about $754,000 were paid out to providers through the hazard pay program. And then through this fall, we also provided the child care workforce stabilization program. That was just under $4 million. And so on Sarah Truckle, can you remember the payment that went out per employee under the stabilization?
It was $938.
Yep. And so per employee. And so all told, from mid-March through December, through the work of the legislature and the administration and accessing the Corona relief funds and other dollars, we were able to provide just almost $40.5 million into the childcare system to sustain it and make sure it was viable as we came through the pandemic. And I would note, move to the next one. I would note that the stimulus package that passed at the federal level in late December includes additional dollars for the child care system. We've not received our official award letter yet. We're waiting to receive that. but we believe that based on our calculations, that will be between $12.5 and $12.8 million. And then we have until I think towards the end of February to submit a state plan of how we will utilize those dollars and spend those dollars in the childcare system. And we're already meeting with our providers and our partners to understand what the need is and how we should use those dollars to support the childcare, in the coming months with those funds. We're seeking their input on what their needs are right now to make sure we understand that as we prepare our state plan to spend those dollars.
Has the federal government released guidelines on how to use that $12 million, or is that still happening? Or is it an RFP process or grant process? Or are we getting it and then you justify its use?
Yeah, Sarah Truckle, you want to jump in here in terms of what we know right now for the use of those funds?
Sure, happy to do so. So we know that we can, they've released some information. So we know we can use it for things like lost tuition. We know we can use it to support family copays. We know we can use it for additional expenditures at the provider level around increased costs associated with COVID. But we're not sure, they haven't really elaborated on what the other categories are outside of things like lost tuition, increased expenses, and provisions of care for families. So that's what our current limitations are. And we're hoping to have more guidance, and our CDD policy team is meeting with our federal partners as that guidance is being developed. So we're certainly involved in that.
I would say in our work with, talking to our partners, Let's Grow Kids and others and providers, with our experiences and lessons learned from administering those other $40.5 million to those various programs, I think there's a couple things we want to keep in mind as we move forward to spend those dollars. Some of those were reimbursement based, like the relief grant program. And so providers had to tell us how they wanted to spend those dollars, and then they needed to submit expenses to get reimbursed. I think we would just want to, figure out how those dollars can be spent and provide those upfront on some sort of formula base to all the providers, and then they just tell us how they spent those dollars. I think that's easier for providers, and to be honest with you, it'll be easier for our team as well to manage a process like that. So that's kind of the thinking of how we're approaching it.
Yay, thank you.
And then we'll move into the hub program, and Miranda Gray is with us. She actually is the deputy director of the Reach Up program, and we borrowed her to come over and work with the Child Development Division and the Agency of Education and the school districts to help stand up the hub program at the end of last summer. And we were happy to have her. She did a fabulous job, and so I will turn it over to Miranda to kind of walk you through the hub program and where that and the status of it currently.
Good morning. For the record, my name is Miranda Gray. As Commissioner Brown mentioned, I'm the TANF Deputy Director for the Economic Service Division. And this fall, I was temporarily reassigned to be the project manager for the school age hubs. I'd like to take a moment to say that the School Age Hub project was a success because of strong collaboration and teamwork. Vermont After School is a dedicated and thoughtful partner that hit the ground running when we engaged them in conversations in mid-August about setting up hubs. Let's Grow Kids, the Agency of Natural Resources, the Division of Fire Safety, the Agency of Education, our licensing division within the Child Development Division, and the Department of Health, as well as many community members, made establishing hubs their priority. It was because of this teamwork that we were able to establish 43 hubs with 93 locations. No hubs were established in areas of the state where children were in-person learning 5 days a week, or where children were in person for some portion of their school day. Hubs were given funds to cover startup and expansion costs, as well as the first month's operating costs. Hubs that continue to run do so by collecting CCFAP for those that qualify, fees from families, private donations, or other grant funds. As of 2 weeks ago, we have 82 locations actively serving children. However, this is a moving number. As schools bring children back to in-person learning, there's less of a need or no need for a hub. Of those 82 sites, 66 of them were regulated programs, and 16 were unregulated or exempt programs. We've had 11 sites of the 93 that have closed because there was no longer a need for their services. This committee asked how have the hubs worked in practice. So as noted, most hubs were existing providers. There were after-school programs, recreation and park programs that stepped up to provide care, as well as childcare providers who were able to shift to serving school-age children because they had vacancies in infant, toddler, and preschool slots. And that was because of the legislative change that allowed for them to care for children, school-age children during the day. We also found that hubs that had strong connections to their schools tended to establish themselves and fill enrollment faster than those entities that were less connected. We were able to provide care for over 6,000 children. Hubs also reported that it was having these funds was really significant in being able to buy the supplies that they needed, which could be computers for the children so that they could connect to their online learning, to be able to get Wi-Fi or upgrade their Wi-Fi because they would have multiple children needing to connect to their classes. And it did allow for parents to be able to have a safe place for their children to go if they weren't able to go to school. We also have some lessons learned. As Commissioner Brown has already mentioned, and the committee here has noted, we had no way of knowing what parents were going to choose to do. So given the timing of the schools reopening and the hubs being established, we believe that some parents had to make other arrangements. We had some hubs that were ready to go September 8th, and then we had others that were starting up more so in October, which also happened to be sometimes when schools were bringing children back in person. There was really quite a variety. So our greatest lesson there is just to communicate as early as possible to parents so that they can do the planning that they need to do. The cost of families was a challenge. Although the Child Care Financial Assistance Program was made available and expanded into the hubs for those families that didn't qualify for this assistance, this unexpected child care expense was a challenge. Many hubs reported that they sought out as many private funds as they could to assist families to afford care. Hubs also reported that it was a challenge to balance such a wide range of ages and as well as their educational expectations, both having to connect to virtual classes, varying from a couple of minutes to a few hours, and then also the independent work. And just for hubs to be able to support children in their new educational styles that schools have now. Staffing was also a challenge, not only hiring initially, but also retaining. With hubs, there was an uncertainty of how long the hub services would be needed. So it was challenging to know if a staff member would have a job for a month or if they would have work for 4 months. Hubs also reported that they found success in having lower ratios. So we allowed for a ratio of 1 to 15. However, they reported that that really was challenging if you had such a large group because of the really varying needs of helping a kindergartner, learning how to read from helping a 6th grader with their math. Those were very different needs that needed to be serviced, but they did such an amazing job, I must say. They shared a lot of their videos with us and a lot of the creative times that they had outside. They tried to have children outside as much as they could when they weren't needing to connect to their classes, and they truly provided some wonderful experiences. In closing, we feel establishing hubs to support families this fall was successful. The providers that stepped up this spring to provide essential worker childcare, the providers that stepped up this summer to provide summer care were often the same providers that stepped up when care was needed because the school was not able to open in person. The COVID relief funds allowed these same providers to be able to purchase the necessary equipment, technology, and space as a few examples in order for children to be able to connect their schools for their education. I welcome any questions that you might have. I'm also happy to answer them later if you would like.
Questions at this point for clarification? So what I'm hearing you say is that the hubs were primarily for kids who are school aged?
Yes, that they had kindergarten through 6th grade.
Okay. And the folks who were the childcare workers at the hubs were who?
So they were often the providers that already serves children. It might just be that they needed a variance to serve the school age children. And we didn't have, we had some businesses that reached out, but really what we ended up doing was pairing them with existing providers to be able to support their employees.
Okay, yeah, thank you. And we did pass that legislation that opened up family-centered folks to care for school-age kids more regularly.
thank you.
All right, yeah, okay.
Mhm.
All right. Any other questions, committee? Thank you for that. That was very clear and very helpful.
Welcome, thank you.
Okay, thank you, Miranda. And then just moving through, I just wanted to I think Vermont has a lot to be proud of in the way it responded in support of its childcare system. It was recognized nationally as a model. And I think these are just some links to some articles that have kind of touched on Vermont's response and kind of recognizing it and pointing it out for the rest of the nation kind of as a roadmap. And then also, we touched on, a little bit about the new money coming in and our lessons learned. And, so we'd already touched on that a little bit. We want to make it as seamless and easy for the providers. I think lesson learned is that, we don't want to make our processes and our documentation required to issue out funding to be complex. Many of our providers work long hours caring for kids and planning for caring for kids, and the business aspect of applying for federal funds it can be very complex, and so, or other funds, and so we want to make it as seamless as possible and easy, and that is our goal in this next round of funding that we're getting from the federal government. And I would also point out that the new administration is talking about an additional stimulus package, and it's our understanding that as a part of those conversations, there may be even additional resources coming to our child care system if there's another stimulus package as well. We'll just have to wait and see, depending on what, if that does materialize, what does that look like once it passes. But hopefully there's additional opportunities to provide financial supports to the system in the coming months as well. And then just some highlights. I would just, I can't say enough kudos to our childcare providers. They really stepped up and have continued to stand up throughout the pandemic, to meet the, early on to meet, stay open and meet the needs of essential workers, open up throughout the summer to continue to provide summer care, which is a critical time. And then also those that adapted and adjusted and to help cover the hub systems and to cover school-age kids as well. It was just a tremendous response. And they are some of the true heroes of Vermont's response to the pandemic is our childcare workforce. I think that just to recognize that. I think the other thing we really recognize, particularly through the hub, is that we broke down a lot of silos and working with, Agency of Natural Resources, fire safety, that you could really move quickly to establish centers to care for kids, but also, meet the health and safety requirements necessary to care for kids in a safe manner. And that we want to continue to leverage and build on those relationships that really were strengthened in response to the pandemic as we quickly, if you imagine how quickly we planned for, announced, and then stood up the hub system, it was truly a phenomenal effort. And it wouldn't have been possible without that collaboration with everyone that Miranda mentioned there. And then also, we have some teams working to continue to identify recovery strategies, and how we can, continue to build resilience in the system, not only as we continue in the pandemic, but also as we prepare for the next event that could come that we just don't know down the road. But we've learned a lot during this pandemic, and I think we want to leverage that in planning for future events as well. And then we also have received some additional base funding as well through the federal government. In the last budget that passed, they added another $85 million at the federal level to the system, and so we are going to receive some additional funds from that. And Sarah Truckle, I didn't know if you wanted to touch on that a little bit, what we know from that right now.
We are not certain exactly how much the allocation in Vermont will be, but from the last round of increases for FFY20, Vermont's allocation is $660,000, and this is an additional $660,000. So we expect it to be less than that, but it will provide additional funding towards CCDF qualified activities. For the committee's information, the current use of the new $660,000 is the first module of the new CDDIS system, and we are leveraging that for the first 2 federal fiscal years, which was last fiscal year and this fiscal year, in addition to the $900,000 in one-time funding from your prior appropriation to fund the first module of the BFIS system. And you'll see that in our FY22 budget documents as well as BAA.
Okay, and Sarah, if you could, and then moving forward, we're still in the pandemic, as I was touched on a little bit, and we do know that we have some additional federal funding coming now. We're just waiting for that award letter, and then there may be some additional dollars. What we don't know is if eventually if those resources stop, how does the market respond? Will we make it through the pandemic? What does it look like? The other thing that we really don't know, and we touched this on a little bit, families have really learned to work in new ways and adjust in ways to the pandemic. And we've seen that in the utilization drop in the CCFAP program. And once the pandemic ends, what does our new normal look like in terms of work? Our business is going to continue to allow their employees to work remotely. And if they choose to do so, are they going to choose to keep their children with them at home as they did through the pandemic? And so will we see the utilization rebound or not? Those are things we won't know until we get further along in the recovery. And then we're going to need to be prepared to respond based on what we're seeing in terms of changes behaviors. And so I think, we're in a pandemic still, and there are, things could happen that we don't foresee and that we will have to respond to, and the system will have to respond to. And so we're prepared, continually adjusting and assessing, in response to the pandemic, and we'll continue to do that and prepare the best we can for those unknowns that come. But there are unknowns out there, and I think we just need to be aware of that. Until we're out of the pandemic, there's still risk to the system. And then, as Sarah indicated, we are on our way to building out the first module of the IT system, for the Bright Futures Information System. It can't come soon enough. The existing system is pretty rickety, and we spend a fair amount of time doing workarounds to make sure providers get paid. And so it's essential that we, not only to meet federal requirements, have that new system, but just in administering the program day to day, it can't come soon enough. And so we're excited that work is underway. We've gone out to bid with a request for proposals. They've selected the vendor, and we're in the final negotiations. And so our goal is this first module will be live and functionable on the first day of the federal fiscal year on October 1st. The other thing I would point out is, the governor's proposed budget for 22 has a one-time dedicated funding source of $53 million for IT projects. The remaining modules were identified as a project for those funds, and so we're excited that there's an opportunity to complete the rest of the build out, and the funding's available for that. And so I'll take any questions that the committee has.
You're muted, Madam Chair.
Darn. Listen, I think it's pretty clear. Does anyone have questions at this point? Or we just have to wait and see what the guidelines are and requirements for the funding and how much we get. And I know we'll be going through this again with you at some point.
Yeah, I
Yes,
just
yes.
Go ahead, Senator Hardy, go ahead.
thank you. I just wanted to say thank you to all three of you. I'm incredibly impressed with all the work that you did. I was in close contact with a number of you throughout different times in the pandemic. And obviously nothing was ever perfect, but you went above and beyond to try to help our childcare system. And I think that that's amazing and very appreciated. I do think the system will bounce back in terms of demand afterwards. If you've seen the unemployment numbers and the numbers of women who've become unemployed during the pandemic in our state, that's an indication as to why some of the demand has decreased for childcare, because women are out of work. And also mothers are making the choice to stay home with their kids when they can. But they're doing so and working under really difficult situations with having multiple kids at home. And so I do think there will be an increased demand, and we need to make sure that we are ready for it and we have the system ready for it. So anything we can do now this year, and I know that's what you're talking about, to make sure the system is robust for the post-COVID world is going to be crucial.
Yes, points well taken. Thank you. I think your observations are spot on in terms of the impact and why we're seeing the decrease in utilization.
Okay, any other questions? So why don't we go ahead? We've got a few minutes left to give us a short introduction, at least, to the restructuring, which I think is going to take a lot of our time to fully understand. So I'm going to suggest that we just get the broad overview today, and then we're going to schedule you in another day so that we can have some time for questions and discussion.
Sure, we can quickly we have a PowerPoint, and we can quickly just walk through the high level of it and not get real into the weeds with it. And then just, as you indicated, we're happy to come back and spend as much time as needed for the committee to walk you through the proposal and answer all of the questions that we know will come. So. And so this is a PowerPoint that we're presenting later today in a joint committee with the House Human Services and the Education Committees. And so I'll just quickly touch base on, the Child Development Division components, really compose of early child care and learning, the child care licensing system, the quality and system integration pieces, the CCFAP, financial eligibility subsidy program, the prevention components of that, where we work closely with our parent-child centers. There's training and development, and then a piece of that is the children's integrated services, and then there's the core operations team in the central office that kind of oversees all of the operations, and that's just kind of a high level of the Child Development Division, so you can contextualize as we're talking about the initiative that we're proposing. And I do want to say that we understand what we're proposing is a pretty drastic realignment of systems of care, and we understand that that's complicated and that there's a lot of conversations and planning that would need to occur to make that happen. And so the implementation of this and our vision and planning for this work is that it would go into effect on July 1st, 2022. And so in the state fiscal year 23 budget. So there's nothing in the governor's current 22 recommended budget, and there was nothing in the BAA regarding this proposal, because at this point, there's a lot of work that would need to occur if there's support to move this forward, working through the spring and the summer and the fall with our partners and all the implicated systems to make sure we're all in agreement with how it would work, and then how the dollars and positions would then move in the 23 budget. So we recognize that this is the start of the conversation and the planning and work around that, with a goal of that it would take effect on July 1st, 2022. And so this really is looking at moving forward the governor's vision of a cradle to career education system. And a part of that would be aligning, early care and learning under the Agency of Education, which would then include early care professional development, integrated lead to early integrated intervention, universal preschool under one umbrella. Right now it's a bifurcated system, with the providers, the home-based and other school providers, childcare providers under the Agency of Human Services, and the school-based system, the Agency of Education. And we believe that this will really lead to more kids ready to enter kindergarten as they exit, what now is a bifurcated 0 through 5 system in the AHS, but placing it within AOE, we would be able to streamline those transitions from those different systems of care that occur now when children enter, the kindergarten through 12th grade education system. And so we believe that by streamlining, there's a lot of benefits to kids and their development by streamlining, the early care and learning under one agency, being the Agency of Education, with the expertise and, throughout the system, being able to transition kids from one system to the other right now, which is a very bifurcated system right now. We believe there's increased value to families and kids in this, and providers. It would provide a streamlined application. Right now, there's 2 systems for pre-K. There's the private market and the public market. And so by having one streamlined application, we believe that would really make it simpler for families to access that pre-K for their kids. Also, right now, the IDEA funding is split. And so by consolidating this work, early care and learning work and some of this specialized services, it would provide consistency and integration of those funding streams and services, so that it would be seamless, so kids wouldn't be jumping from system to system as they hit certain age markers. All of that would be under one system of care. We believe that would benefit kids in many ways. Also, it would align the eligibility system into the Department of Children and Families, where we have the expertise and history of administering programs. We're not proposing changing how the system is administered in the community, with the referral services and the eligibility work being done by our community partners. Though that work would still be done at that level, it would just be overseen within the Economic Services Division, and the staff that administer that would move over to support that work there. Also, given that our systems are delivery systems are fragmented, our data systems are fragmented. And if we're able to streamline our services, we would be able to also streamline our data collection and data reporting systems, which I think would add tremendous value to outcomes for kids and analysis and system improvements, which would then lead to better outcomes for kids. Also, by moving certain pieces of this to prevention services to the health department, we believe that it will provide uniform and consistency with our home visiting. Right now, that's kind of managed at different levels within the agency. And we've been working closely with the health department now to bring more of that in line, and this would just complete that vision. And then also any savings from the streamlining of these services in different areas would be reinvested back into increasing services for kids. This isn't about saving money for the bottom line. This is about better outcomes and better services for families. and any savings due to efficiencies gained would be reinvested back into increasing services for families and kids in this model. And then I'm going to have to unfortunately bow out and testify in the House. And so I'm going to have Sarah Truckle take over and complete the PowerPoint here real quickly. And then she'll join me in the House Human Services and Ed Committee. Are there any questions so far?
Not at this point. I think, well, Senator Hooker has a question, but I'm going to say that this is really the high level. We are going to have to dive down much more thoroughly into this. And I know education also has an interest in it, so we'll be talking with them. Senator Hooker.
I just wanted to know what IDEA B and IDEA C stand for, what the acronyms stand for. I know I'm going to need to learn a lot more about it.
Yes, and I'll have Sarah Truckle jump in with those explanations. It's a federal funding streams. Sarah, are you? Yes.
I am still here. So IDA Part B and IDA Part C are the, and I'm trying to remind myself of that exact acronym, but it is the funding that is received from the federal government from their agency of education as it relates to special education funding for children. So IDA Part C covers children 0 through 3, which currently is done and administered through Children's Integrated Services at CDD through our early intervention program. IDA Part B is administered through the Agency of Education from 3 through 5, and then special education impacts us once we are in children enter kindergarten. And that's what we're talking about, of those different ages, and why we're looking to streamline that under the Agency of Education, so that families have that sole administration under one agency, and they don't have the current handoff, which isn't as seamless as it could be if it was housed integratedly.
Thank you. So when you talk about bifurcated, that's what you mean.
It stands for Individuals with Disabilities Education Act.
Yes.
Thank you.
Yeah.
All right. Any other questions? Okay, so why don't we try to finish pretty quickly. We have Holly Morehouse coming in, who is here, and we want to move on to talk with her, and then we have another bill to look at. So, we will have you in for a longer period of time just on this issue. So
Sure.
thank you. And thank you, Commissioner, for
Sure,
being
and I
here.
will just close by just highlighting that. So our proposal really breaks apart the Child Development Division and moves the pieces into the other departments or agencies that take leads in other areas of that work. So as we've discussed with the Agency of Education, there's a lot of prevention work that would move to the Department of Mental Health. A lot of children's specialized mental health services would realign under mental health, and the funding that mental health funding that would flow there. And then also that eligibility piece would stay within the Department for Children and Families, and some other prevention pieces tied to the family support, family services division. And so as your chair indicated, this is a real high level, and we're happy to come back and really delve into the details and answer your questions. And,
right, and I know we're going to be hearing from the organizations that are affected by this. So this will take some time. I do have a question for you, and that's this. Right now, we're in the middle of a very stressful environment. So we're in the middle of this pandemic, and we can only imagine what the stressors are for all of the people who have kids, especially single parents, especially mothers who have lost jobs and need to stay home, and others. At the same time, we know that many of the people who are engaged, will be engaged in the reallocation, represent those groups of people, and they're under huge stress. And so I guess my question is a general one for the administration, and I don't know who can answer this, but why would we present this huge restructuring at this time? And if it is necessary and if it's appropriate, how does it meet the needs that we have identified during the pandemic? Well, with there are gaps, no question about it. But I'm not hearing that the solutions are solving the problems. So that's my question. It's a twofold question. One is on the mental health of the people who are engaged in all of this and boots on the ground. And the second one is define the gaps that we're closing resulting from the pandemic. And I know that there are other issues that have been identified previous to this, to the pandemic. But it seems to me, well, I'll stop there with those two questions.
Sure, and without having gotten into the details, I would say one is, I think we recognize we are in a pandemic, and that's why we're proposing at the earliest a start day of July 2022, just under 18 months from now. Just recognizing we all have a lot of additional work on our plate, but we also believe the pandemic has exposed the inefficiencies of some of our systems of care. We are seeing increased needs of some of our families and children. And by realigning some of our prevention and intensive services, like within the health department, we think will lead to much better outcomes for our children and families, particularly early childhood and families with home visiting, and realigning all of that work under the health department and their evidence-based models. We believe it will provide a better outcomes for families and some of those cracks that we've seen.
This is going to be an ongoing conversation, Commissioner, and I don't think there's a simple answer to it, frankly. I've heard from people, and not just in your area, but in other areas, who are extremely concerned about some of the restructuring that's going on in the midst of a pandemic and the stresses that are being caused when people are working remotely and unable to communicate one-to-one with their managers and others. So I have grave concerns about the effect on our state employees. Just that's my comment.
Sure.
That's
Thank
the
you.
stress comment.
Understood. Thank you.
Okay, you're welcome.
Yeah. Yes.
So I guess it's Sarah, you're up to finish this part, and then we'll move on to Holly Morehouse, who is waiting in the wings.
We appreciate the committee's time this morning. Thank you.
Oh, thank you.
So I suppose I'll start on this slide giving a high-level overview of what we're looking to restructure and move around. So for the Agency of Education, the proposal would be to move all of our early care and learning, including our childcare licensing and our regulatory system, into the Agency of Education. This would eliminate the current co-administration and coordination of Act 166, as well as eliminate the current coordination and administration of our after-school providers. As the committee may know, after school is currently regulated within the Child Development Division. However, AOE has 21 first century grants, which also administer funding to after school programs. So that is depending on the school, depends on different types of administration. Additionally, we would provide, it would provide for birth through grade 12 care and learning, as well as technical education under the Agency of Education. It paves the way for uniformity in our professional development and career paths and integration for early care and learning professionals. Right now, we have early care and learning professionals within CDD's professional development system who are also administering preschool, as well as within AOE's administration who are administering preschool in the public school system. It places early intervention, as we've discussed, IDA Part C and IDA Part B under the Agency of Education. This will enhance services to families, and it will, we believe, streamline that current struggle with the shift at age 3 when families go from our early intervention services at CIS to IDA Part B services, and allow for better integration, case management, and transition during children's earliest years. In addition, going to within AHS, within the Vermont Department of Health, we would house our current kind of public health and prevention programs within the Children's Child Care Development Division within the Vermont Department of Mental Health. This includes many of our prevention services and grants that are grounded in the public health response, including our master grant funding for our parent-child centers, as well as home visiting, as well as our dollars around children with special health needs. These are programs like our special accommodation grant programs, and some of those supplemental services provided by Children's Integrated Services now. The Department of Mental Health would receive Children's Integrated Services, Early Childhood Family Mental Health Services, also known as ECFMH services, including consultation, referral, and treatment services for children 0 through 6. These services used to live at DMH, and when CIS bundled a little over a decade ago, moved into CDD and Children's Integrated Services under that bundle. We are proposing that those services return to DMH and have all of ECFMH within the Department of Mental Health. Finally, remaining within the Department for Children and Families, as Commissioner Brown indicated, would be the Child Care Financial Assistance Program, which pays child care tuition on behalf of eligible families. We believe that our Economic Services Division, which administers many different benefit programs, is poised to take on this work, and we would continue to have the eligibility functions remain in the field, but the oversight be done by the Economic Services Division. In addition, prevention of our child welfare or child abuse and neglect, which currently some of those funds sit within our Family Services Division and some of those funds sit within our Child Development Division, would all be streamlined under our Family Services Division, which internally for DCF, it makes sense. And you actually see some of that. We've already done some of that over the last several years. In addition, it codifies our transportation restructure that we proposed last year and then delayed due to COVID, which unites CDD's specialized childcare transportation with Family Services Division's transportation contracts. And we are currently pursuing a statewide RFP with the idea of creating a statewide transportation network, which will reduce the amount of contracts and oversight and administration currently that we have. I realize
Sarah, you know, what I'm going to suggest is that you close out, get to a closure on this slide, and then that we hold this for another day, because we do have Holly here, and we do have other testimony coming up. So, with apologies, but I think that's the way it has to be.
No worries. And that's actually perfect, because the most of the remaining parts of this PowerPoint were actually deferred to the relative commissioners of health, mental health, and the Agency of Education. So the only last point that I would add for this committee to understand at a high level is that this proposal does propose to unbundle the Children's Integrated Services current contract. And I know that that's something that we're going to need to discuss a lot more, but I just want to make sure that it's, as we talk about it, it's clear that as these services move around, that obviously impacts the bundled case rate.
Yes, it does. And it affects a lot of pro bono care that we see within integrated services, so CIS. So when you come back, it would be good to have those acronyms spelled out for us, but I get it. I see it's early child something, family, mental
Early
health.
childhood, family mental health,
That's it.
specialized childcare coordination, home visiting, and early intervention.
All right. Those are all, those are clear once you say them. Okay. Sarah and Miranda both, thank you so much for bringing us all this information. This is a lot to take in. The best part is now I think we've looked at the sort of the historical piece, and we've seen the pandemic funding piece and information. Then we're going to have to dive into the restructuring proposal that the administration is suggesting. So thank you. Thank you.
Welcome.
All right. Committee, we're going to stick right with it, and we're going to move to Holly Morehouse, who is here from the Vermont After School Program. And Holly, if there is a way to consolidate your remarks, that would be great. I know we've had you in committee before, but there are folks here who have not heard about after school. And I think it's important, particularly given the pandemic and also the restructuring that's going ahead. So I think this might be the first time we see you, and there will be other times, which is great.
Thank you so much. Really appreciate it. Can you hear me okay?
It's a little
Yeah.
soft.
All right.
Try that.
How's that? Is that better?
It. It's okay for me. I don't know what others think.
Okay. How about if I hold this mic up really close?
That's really good.
All right. All right. We'll go with that. Thank you very much. All the technology changes. So for the record, my name is Holly Morehouse. I'm the executive director of Vermont After School. We are a statewide nonprofit that was formed in partnership with a number of state partners and providers back in 2009. We specialize in child and youth development, positive youth development, and we work with organizations that support children and youth outside the school day and the summer. And we work with children all the way from kindergarten all the way through high school, and also young adults as well. And when I speak about after school, I really am speaking about that broad space outside the school day, summer vacation, holidays, in-service days, teen centers, boys and girls clubs, licensed childcare programs, school-run programs, and community centers and so forth. So it's a very broad and a diverse field. I am going to consolidate my comments. Miranda always does an amazing job summarizing the hub, so I, could echo many of the things she said. I would like to just step back and hit some of the main points of what it was like to work on this project, because I think there's lessons learned there. I'd say first and foremost, it was one of the most rewarding projects to work on with the state that I've ever experienced, and I've worked at the state with the agency in the Agency of Education. I've worked with a number of state agencies, and with the quick turnaround time and the demand and the crisis going on and the needs of working families and employers, the stakes were high. And Miranda was an amazing partner to work with, and the whole Department of Children and Families really leveraged every resource and every partnership to make this happen. Miranda and I had our cell phones with each other. We were on at 10 at night or 5 in the morning or whatever it needed to be. And it was quite a powerful experience, and I can't say enough about that openness of the state to partner with us in that way, to let us be the voice of the field in that way, and then to leverage whatever they needed to leverage on the state side to make the hubs come to fruition. The other piece that is a big takeaway for me from this project is it really highlighted the disparity in our state of what was available for children, youth, and families during this crisis. So we already have a landscape in the out-of-school time where what you have access to for your children depends on where you live, whether or not there are even programs available, how much money you have, and whether or not you can afford to send your children and youth, and transportation is the other one. So if a program doesn't run the right hours that you can get home, get off of work in time to pick them up. Sometimes parents can't take advantage of a program that exists, and their children need to go home on the bus right after school because they're not going to be able to pick them up. And there was a report done by the After School Alliance just this past December, and it found those three main barriers in Vermont. We actually rated in Vermont as in the top 10 in the nation for the quality of our after-school programming, high levels of parent satisfaction, high levels of staff quality, but we were the lowest in the nation for the percentage of children and youth in our after-school programs who qualify as low income. So tells me two things. We know how to do after-school really well, but we're not yet able to reach everyone. And those three top barriers were the accessibility, areas with no programs, the affordability, and transportation. So that disparity was, we saw it again with the hubs. We could only set up a hub really quickly and easily where there was already an existing provider in after school, a Parks and Recreation Department, an after school program, a community center like King Street or Sarah Holbrook, somebody who was already in this space who could move in and work with the children and with the families. We had parts of our state where children were back in school 5 days a week in elementary school, and particularly in the northern part of the state, and then an after-school program was opening up at 11 or 1 whenever school got out, usually early, and running until 5. So if you were a family that lived in that community, you had care and learning for your children 5 days a week, pretty much the full day. We had other areas of the state where the buildings were not open, the schools were not open. It was 100% remote, and we had a hard time finding providers to step into the space in the time that we had in that 4-month period around the hubs. We also found that, and Miranda alluded to this, having a system where it relied on parent fees to pay for all the additional care was really burdensome to families. Sometimes families were bringing their child to a hub in a school building. So maybe it's a hybrid school schedule, let's say. So the child's there Monday, Tuesdays for their school in-person learning. Wednesday, maybe everybody's off for remote. And then on Thursday and Friday, supposed to be remote learning days, and that's the child's now going to the hub in the same school building, but now the parent had to pay, right? So it's a remote learning day, and they're paying for the care in the same building, and that was, often hard for parents to see why that was that way, and also often hard to make the family budget work to add, 6 to 30 hours a week of additional child care in those times. Another big point on that is sometimes we have the assumption around childcare that when children get to 6th grade or 10, 11, 12, that they're old enough to stay home alone. It would have been awesome if the hub project could have expanded up to 7th and 8th grade at least. We had many parents of middle schoolers who were looking for that support and care. And I know that is often outside the definition of the need for childcare, but you are also a committee that looks at prevention and health issues, and the risky behaviors happen in young adolescents and teenage years. So the same years that we're starting to say, oh, we don't need after-school programming or summer programming for children of this age group is actually counterproductive to our primary prevention goals of having them in safe and supportive environments. The peak times for kids to engage in risky behaviors are the hours of 3 to 6 p.m., not 10 at night, 3 to 6 p.m. when parents are still at work and they're unsupervised. And in the summer, it's also an issue. This is a, Commissioner Brown said this is a bold, adaptive, amazing field. The after-school providers, the youth serving organizations provided that essential child care when we were in crisis in the spring. They found a way to run summer programs even when schools would not open their buildings and allow them to use those spaces. They often were the ones then who could go back and work with schools and talk about how do you reopen, right? We've already done it. They've already followed the health guidelines. They worked with the health guidelines all summer long. Schools that could partner with after-school programs who did that work in the summer actually had a head start and were more confident at restarting in the fall. And then finally, throughout the fall, as teacher staff shortages and substitutions and rates varied and the need for hubs increased, these were the providers that stepped forward. Madam Chair, I want to pick up on the stressed, exhausted population that we have. I know state workers are really stressed and exhausted. I will say this field is so exhausted. I have worked with this field for over 20 years, and I have never seen this level of exhaustion. So more change at a time when the landscape is constantly changing could harm our field in ways that, just sending money and supporting them through funding isn't enough. There's something else about the human side of what we're asking people to do and how to respond in this changing landscape.
Holly, thank you for that comment. I did not mean to exclude non-government workers from my comment, because I do understand everything you just said, and I appreciate your comment.
I knew you did. And I just really needed to say, I can't stress enough how impressive this field has been and who they are. I mean, they're paraeducators who are working in this space. They are retirees. They are college students. They are community members. They are youth-serving professionals that this is their career full-time. It is really a diverse, they're artisans. It's a diverse and wonderful field. And we need to care for them as people and as a field. I will say also that I think it was really appropriate that the child care hubs was part of AHS. For me, AHS looks at the whole child, the whole youth, the whole family, right? It's the Department of Health, it's the Department of Mental Health. It was the licensing division, it's juvenile justice, it's family services division, it's children in foster care, it's children who are experiencing homelessness. That whole wraparound piece, that is also what after school is about. After school is about learning. Yes, it's about enrichment. It's about STEM, but it is about resilience. It is about family needs. It is about making those connections across all those spaces. And with the hubs, schools did not always want to step into this space to offer the hubs. Employers did not always want to step into this space. And I'm not saying that to be critical. I'm also trying to recognize the burden that is on our schools and on our educators. And we hear over and over again about not being asked to do one more thing. And I think instead of trying to put everything into the education system, if we can instead build up this family and youth and child system around it, the human side around it, that we actually can support both and strengthen both. And I think that is part of what the hubs was all about. For additional funding, there is still great need. There were many programs that didn't qualify for hub funding because there were not remote learning days, but they actually ran extended days of programming. They started at 11 and went to 5, as I said, and they didn't have that in their budgets. So there is a real need in winter and spring to continue that extended and modified schedules based on what schools are doing in different areas of the state. And I will also say there is a tremendous need. I wish we had been able to do it last summer, but definitely in 2021. This needs to be a summer of community connection for our young people. It needs to be a summer of learning that is about adventure learning and peers and friendships and youth agency and youth voice, not just remediation of the learning skills, but all that connection. There's some data in my presentation about where our youth are in mental health from the fall. I encourage you to take a look at it. They are lonely, they are anxious, they are stressed, they are isolated. And I fully appreciate moving forward with federal funding and making it flexible so existing providers could use it in a lot of different ways. I also think there is a state role, a state leadership role that says right now we all need to be thinking about what we're offering for our youth this summer. We need 6, 8, 10-week programs full day for our children and families to make up some of that time we lost. We need to use community providers, and we can't, I don't think just put the money out there and expect it to happen. I think we need to be convening folks and really intentionally sending the message of what this is what needs to happen. And the same way that the Department of Health did last summer when they said young children need to be back in school, right? And the governor has said that. I will say next summer, all of our young people and children need to be in engaging outdoor amazing programs that have access to food, enrichment, peers, and positive adult role models. So with those comments, I will happy to take any questions, and I really appreciate you listening and paying attention to this issue.
Thank you for your comments. I think when people hear the word after school, they immediately think of educational institutions providing something after the school and day ends. And for me, with all the work that you've done and the information you continue to provide us, it is the cultural shift that is a prevention shift, and all the work that's gone on in other countries that has been so effective. Yes, so thank you for your comments. As you were talking, it occurred to me, wouldn't it be wonderful if we could say everyone gets 4 weeks of vacation next summer, period, not taking away from your accrued vacation time, but just everyone has a Vermont summer time with family and friends as soon as we can do that. So it is a need, and I really appreciate the comments that you've made about maintaining wraparound integrated services for folks. So committee questions.
Judy, Madam Chair.
Yeah, no, go right ahead. Go ahead.
Thank you, Holly. Thank you. So important. All of this is just so important. And I really appreciate, as the chair said, that you're pointing out how after school programs are really more than that. And I'm recalling the presentation we had from the fellow from the Netherlands, Finland, and they called it the third space.
Yeah.
And, you know, it just makes so much sense to call it that third space. And I remember the term, you know, latchkey kids and, you know, stuff like that. And those are things that should be things of the past, and we should be able to accommodate all of our kids. That being said, I'm wondering if you could just comment a little more on the flexibility of federal funds and how that, you know, can play into this and allow us to do the things that are necessary for our kids.
The funding that we have heard coming down that could be used in this space, there are 2 pots, actually 3, because there's some governor's discretionary dollars, but there's the child care dollars that Commissioner Brown mentioned, the 12.8 that can go towards child care. So that's up to age 12. And then on the education side, there's also education dollars that will flow and go through districts in a large way, it seems to be. So the beautiful thing with after school is you can braid multiple funding sources. The challenge with after school is sometimes it can fall between the cracks, right? So that's where I think that state leadership role of calling out things like, we got to really look at summer, right? There needs to be about learning and care and enrichment and social, emotional, and resilience building and so forth. And we need to also, you know, make space for new programs to start, like that support around new spaces. So, you know, sending funding to existing providers or existing schools that already run things is great, but also where's the initiative in order to get to universal access, or to talk about that disparity that I talked about at the beginning? How do we support places that don't have anything? You know, there are schools right now and communities right now that don't run any summer programming. And that's why I'm kind of trying to raise this flag and be like, we got to be running something everywhere. And it needs to have that balance of enrichment and outdoor and resilience building and so forth. So it is going to take those pieces. So I think it's about more than, and in what the written handout, I've tagged some of those actual dollar sources that we hear are coming down. So I think it's about more than just putting the money to providers or putting the money to schools and then hoping that it happens. I think that there's some direction in there to saying about what do we as a state feel is really important and how do we get that initiative. And I'm happy to work on that and convene people and support that in any way possible. that was, I guess, what I'm trying to get at. I don't know if that fully answers. I think there's also this piece too that I will say with the sort of the multi-agency piece, that we also found that the Agency of Community Economic Development was really important in the hubs as well, because all of the town recreation departments, they are under that agency. They're not under DCF or AOE. They're over here. And they were running a lot of the summer programs and a lot of the hubs. So really sending that message about all those players coming together, right? And really thinking about the whole child, youth, the whole family, and the importance of this summer. And how do we use these dollars that, because they come from the feds, they come split anyways. They come split with childcare and education. And I think we know enough here in Vermont that we need that braiding. And so how do we do that?
So Holly, while you're talking, of course, all our little hamsters are running around. And it seems to me that given that we're talking summer, it's not that far away in this kind of a discussion. There must be, you must already have some ideas formulated, and I'm sure that you've talked with folks in all the different areas, whether it's state government, local government, recreational programs, or schools, and so on. So it would be helpful to know what those, what you're thinking, because I think I do have someone who's volunteered as an intern to work with me on exactly what you're talking about, and that is engaging kids over the summer and perhaps longer in outdoor and other activities to close the gaps. So it might be helpful. I don't know. The committee will have to have a discussion of whether they want to pursue this or not, certainly, but it's something I think of interest. It's important. Senator Hardy.
Sorry, Holly, did you have something to say? I can wait to.
I was just gonna say, if there is a way to tap into either of those federal funding sources coming down, and it sets some aside to expand and start summer programs where there aren't any, with all the best practices in mind, I think that would be a really forward-thinking thing for Vermont to do.
So my question, first of all, is you mentioned some data, national data, where Vermont ranks first in quality and last in access, essentially, it sounds like. I was looking through, I was trying to find that in your handouts. Is there one that highlights that study you're talking about, and which one is it?
If I may share my screen, I can show it. It's the
No, that's okay. I have them
okay.
on. I just want to know which one to look in.
Oh, okay. It's the after school for all. There's a summary. It's the Vermont data. So it was a national study, but they also collect state data.
Okay.
They last did it in 2014. This one was done in 2020. And we're 9th in the nation in quality. And then we were 51st. And I can send you a link to the full report.
That would be great.
That breaks out.
Maybe you could send it to the whole committee. I would just like to see that data. And, last year, during the early months of the pandemic, when we were all trying to figure out what the heck we were going to do, I was on the education and the agriculture committee, and our conversations were a lot about summer programming and how are we going to get our kids some summer programming during a pandemic. And from the agriculture perspective, how are we going to get those kids fed? So I think that that's a really important thing to really put front and center, that this sort of basic need of good nutrition and connecting that to local agriculture in Vermont. And it's one of those really amazing win-win situations. Also, we have a ton of summer programs in Vermont, and they're really high quality, and many of them didn't run last summer because of the pandemic. But key to that is this access question. They're accessible to middle class and upper middle class kids, and we bring kids in from all over the country to these amazing summer camps, and yet modest and lower income Vermonters can't afford or access these camps at all. And so I think that a lot of it is not reinventing the wheel, it's providing access to what we already do so well in our state. You know, as a parent, just looking at the patchwork of options for your kids it can be overwhelming. And so wanting to make sure that we find a way to help parents figure out how they can access and get programs to really prioritize that access and say you can't any longer be this elite program. You need to find a way, and we can help you find a way to make your programs accessible. Yeah, anyway, just so accessibility, I think that data point that you mentioned is so eye-opening for everyone to hear. And thank you for bringing it up.
Appreciate your points. Accessibility is cost. It's also, we have a number of amazing summer programs that end at noon, you know, or they end at 2. That doesn't help the working family, right? So it's thinking about accessibility in a lot of different ways. Yeah, great points.
Absolutely. I was there as a working mom, where you run out at noon and pick up your kids and bring them to another place and then run back to your office. It's crazy hard for working parents, and it almost always falls on the mom. That's changing a lot, but it still happens more often than not. And it's really, really hard. Yeah.
Yes. Yep. Absolutely.
Okay. Holly, thank you. And I think what you're hearing is interest and a lot of suggestions. You have suggested that having the federal dollars might enable some work to get done and have things get in place maybe where they're not currently in place by summer. It would be nice for us to know what that recommendation might be, the how much and the where, and who you might be working with, because I have no idea what the new federal funding will hold for our decision making in this committee, but obviously you've identified a huge gap in the system, and it would be one of the things I'm very careful about doing is filling a gap with temporary funds. And once you fill the gap and people expect it, then you have an ongoing program. So trying to figure out how to make that integrated into the system that we have. So there's a lot of thinking to do, and I'm glad that Miranda Gray is on, because I know you work very closely with her in setting up the hubs. And I know you work fast with that. So I'm thinking maybe there's a fast track for the other issues you're talking about.
There is the After School for All program, which was, do you remember the tobacco resettlement money? 600,000 of that went towards expanding access. That money has been all allocated, but there is an avenue and a process for awarding those funds. And I will say the Vermont Community Foundation has actually put money in twice to augment the original 600,000. They put another 50,000 in December, and now another 110,000 in for teen centers in particular. So we have a process of how to identify programs and how to get the money out that we could use. And there is also the current Universal After School Task Force, legislative task force that Senator Perchlik is chairing, along with Representative Payela. That is also looking at a plan, but it won't be in place necessarily for this summer. So there is something about using the federal dollars, even though there may be one-time dollars, to address the recovery needs of our children, this summer as that other plan and piece. I can sort of see those braiding and fitting in well together in our timing. So taking After School for All, really beefing up our summer, helping programs through winter and spring, beefing up our summer, and then having this plan moving forward coming out of the task force. If all goes smoothly.
You've got all the problems solved.
Thank you so much for the time.
Well, thank you for being here. And I feel kind of apologetic because I did not allow for you to meet our new members, Senator Hooker, Senator Hardy, and Senator Terenzini. And I think you have met Senator Cummings in the past, but we'll have you back and we'll do a more formal introduction at that time.
Really appreciate it. Thank you so much for your time this morning.
Thank you. And we're going to move on now, but this is a big area, of work for us. So we'll be getting back to it. It's our first intro. Okay, so Jen is here. I'm going to suggest, Jen, that you allow for us to take a 1-minute stretch. And so everyone, you can go off video and turn your sound off and take a stretch, just for a minute. Okay. Is the State House warm, Josh? It is? Oh,
Warm, and it's pretty quiet here.
I know, you're lucky.
I wonder if there's any food. I wonder if there's any food in the cafeteria.
Oh, I don't know whether it's open or not.
I don't know.
Yeah,
I doubt it.
yeah,
The State House, since the State House isn't open.
yeah.
You might find potato chips.
Vending. This is the Health and Welfare Committee.
That's why there's cheese involved.
Okay, oh, good. A rationale for everything. Okay, Ruth, are you back yet? She's not. Well, there she is. Okay, good. Jen, we have the information on the deadlines that we put in place for specific policies to increase flexibility during the pandemic for some of our healthcare folks. I think what I'd like to do is to begin going through that, and then I think we'll have time after the floor on Tuesday. We've been modifying the agenda for 2 days now. Who knows what we'll be doing, but perhaps we could do a little bit of it today and then the rest on Tuesday. And then I know we're meeting with the House Healthcare Committee on Wednesday, and we're going to be going through the whole thing with that committee and having a dialogue with that committee. So this is our first chance to look at this, and then they'll have more opportunity next week to finish it off. So it's all yours.
Did you want to look at the chart that had kind of the
Yes.
descriptions of what the topics
Yes.
were? Okay.
Yes.
So I will.
That's the one with the yellow on it that shows the deadlines.
Yes, exactly.
Okay. Yeah, that's good.
Okay, so I will go ahead and maybe share my screen.
3 pages, and we have it on our webpage.
Yes, can you see my document? I
Yes,
should be able to make it bigger. Hold on, let me move.
it's pretty
View.
good. Not too bad.
Nope, that was smaller.
Nope, that made a little. It's good. It's not bad.
All right. There we go. A little bigger. All right. Let me put you all up here again. All right. So this is a document that I put together. This is showing the provisions from two acts from last year, Acts 91 and 140. And in one case, there's a third act that did another amendment. But these were the provisions providing regulatory flexibility largely for healthcare providers, and by providers, I mean both individual healthcare professionals and facilities during the pandemic. And you'll see a lot of this was done in, the extensions were done in July, I think. And so, so we really had no idea at that point whether the pandemic would still be happening now or not. So these put in dates to require some revisiting if these provisions needed extension. So the very first one was what was Section 1 from Act 91, and this directs the Agency of Human Services to consider modifying their existing rules or adopting emergency rules to protect access to healthcare services, long-term care services and supports, and other human services, and to consider the importance of the financial viability of providers that rely on public funding. And this had originally been to last during the COVID-19 state of emergency. That was changed to be a date certain, March 31st of this year, by Act 140. And so at this point, I think you're being asked by the provider groups to consider extending these longer than that. Section 2 of Act 91 allowed the Secretary of Human Services to modify hospital provider taxes and waive or modify other provider taxes if that action is needed to enable the providers to continue offering necessary healthcare services, and if the Secretary gets the approval of the Joint Fiscal Committee and in some cases the Emergency Board. This was written in Act 91 to be for the duration of the COVID-19 state of emergency and for 6 months afterward. So this is kind of this travels with the length of the pandemic. And so this was not changed in Act 140. Next, we have Section 3 from Act 91, and that specified, put some requirements on healthcare facilities and human services providers to protect their non-healthcare professional employees from COVID-19. So there'd been a lot of attention being paid to the providers themselves, the healthcare professionals, and the personal protective equipment, PPE, that they would need. And so this had been an effort by the legislature to bring some attention to others who might work in doing scheduling or cafeteria or other services other than the healthcare professionals. So this says to protect these non-healthcare professional employees from COVID-19, all healthcare facilities and human services providers must follow guidance from the Department of Health regarding measures to address employee safety to the extent feasible. And this did not have a date in it in Act 91, so a date was put in to be through March 31st as part of Act 140. The next section allows the Secretary of Human Services to waive or allow variances from the healthcare and human services provider rules that are under the Agency of Human Services as needed to prioritize and maximize direct patient care, support children and families receiving benefits and services through the Department for Children and Families, and allow for the continuation of operations with a reduced workforce and with flexible staffing arrangements. Originally, this was during the COVID-19 state of emergency, and Act 140 changed that to be through March 31st. Can you see when I move this? I know sometimes we've had issues. Yes, okay. Apparently I can't move it yet. Because we still have one more on here. So this allows—
it jumps back up. You move it and then it,
I know, it does seem to—
yeah, weird.
To jump.
Oh, well.
What happens if I scroll? Can I scroll? I opened the document from the website, so maybe
Yeah.
that's not what I should have done.
Oh, well. Anyway.
Well,
Maybe
need to be
click
able to
on the
show it to you,
page
so-
and scroll down with your,
Yeah, I
Well,
think that people have had
scroll back.
problems with doing them from websites, Jen. If you're
Well, I
not-
seem to have problems doing it sometimes from my actual documents too. So let me open the document.
We're filled with help.
Sorry, having trouble finding. I've amended too many things recently. Let's see. Yeah, it's very strange when I open it from the website. All right, well, sorry about my technical difficulties here. There we go. All right, found my document. I will then put it over on this screen, and then I will attempt to share it with you that way. All right, so trying this again. All right, now I think we can scroll. Can you see me scroll? Yes, can you see?
Yes.
Now 5, 6, 7, excellent. All right, let's see if this works. All right, so now we're up to section 5. This allows the Green Mountain Care Board to waive or permit variances from laws, guidance, and standards around hospital budget review, certificates of need, health insurance rate review, and ACO certification and budget review as needed to prioritize and maximize direct patient care, safeguard healthcare provider stability, and allow for orderly regulatory processes that are responsive to evolving COVID-19 related needs. And this, like one of the ones earlier, is for the duration of the COVID-19 state of emergency and for 6 months afterward. So this is another one that is already built to travel, to move with the state of emergency and continue after. Section 6 from Act 91 requires the Department of Vermont Health Access to relax Medicaid provider enrollment requirements and the Department of Financial Regulation to direct health insurers to relax their health insurance plans provider credentialing requirements to allow providers to deliver and be reimbursed for services across healthcare settings as needed to respond to evolving needs. So this was looking at, this isn't about individuals enrolling in Medicaid, this is about Medicaid provider enrollment and health insurance plans provider credentialing so that providers could more easily move across settings if their services were needed in different settings from where they were typically authorized to provide services and get paid for them by the specific payers. So it's not expanding anybody's scope of practice, but just making it easier for them to get paid by their regular payers in a variety of settings. This was originally, oh, yes.
Yeah, but Mike, would this include like telemedicine?
It potentially could. I mean, it's looking at provider enrollment requirements. So if somebody's already a Medicaid participating provider or a health insurer's participating provider, I'm not sure if they would need special flexibility to be able to do telehealth. But if somebody was typically providing services in a hospital or medical office setting and needed to go into a long-term care facility, something like that, they might need that flexibility to move among settings.
Thank you.
So this was changed from the duration of the COVID-19 state of emergency to be until the last terminate of Vermont's state of emergency, the one declared by our governor, the federal public health emergency, that's the one declared by the Secretary of the U.S. Department of Health and Human Services, and the national emergency, and that's the one declared by the president. Section 7 allows the courts and the Department of Mental Health to waive financial penalties for a treating provider's failure to comply with any of the documentation and reporting requirements for involuntary treatment. And this is during the COVID-19 state of emergency. So again, this is waiving penalties if a provider failed to comply with some of the documentation and reporting requirements around involuntary treatment, but doesn't actually waive any of the other provisions around involuntary treatment. Perfect. Can you now see page 2? Great. Section 8 of Act 91, which has been amended twice since then in Act 140 and again in Act 159 for different purposes. This directs the Department of Financial Regulation to consider adopting and gives it the authority to adopt emergency rules in 3 different areas. First, expanding health insurance coverage for and waiving or limiting the cost sharing requirements directly related to COVID-19 diagnosis, treatment, and prevention. So this is expanding coverage and potentially limiting or waiving cost sharing for things directly related to COVID-19 diagnosis, treatment, and prevention. The second piece is modifying or suspending health insurance plan deductible requirements for all prescription drugs. And the third is expanding patients' access to and providers' reimbursement for healthcare services delivered remotely through telehealth, audio-only telephone, and brief telecommunication services. So this last piece is where that audio-only telephone requirement came from, and you have a whole separate report on that you may be hearing testimony from. The House has been already hearing some testimony on that. DFR did adopt emergency rules on all 3 of these topics and modify those emergency rules a couple of times as needed to respond as circumstances changed. This was originally during the COVID-19 state of emergency and was modified to be through June 30th, 2021. So some of the ones we looked at earlier were March 31st. You're going to see some June 30ths in here and then some more March 31st. All right. Section 9 from Act 91. This one requires health insurance plans and Medicaid to allow members to refill their prescriptions for chronic maintenance medications early so that they can have a 30-day supply of each medication at home. And this was changed to be through June 30th rather than specifically during the COVID-19 state of emergency. And a question came up when I went over this in the House. The definition of chronic maintenance medications excludes regulated drugs, which are controlled substances. So to the extent somebody is on a controlled substance on an ongoing basis, this provision, this requirement would not apply to those drugs. Section 10 of Act 91 allows pharmacists to extend a previous prescription for a maintenance medication, again, subject to that same restriction around controlled substances. So a pharmacist can extend a previous prescription for a maintenance medication if the patient doesn't have any refills left, or if the refill authorization recently expired and it's not feasible to get a new prescription or to get more refills from the prescriber. If the pharmacist does extend the prescription, they have to notify the prescriber in a timely manner that they've done that. And this was changed to be through June 30th. Section 11 from Act 91 allows pharmacists with a patient's informed consent to substitute an available prescription drug for an unavailable one in the same therapeutic class if the available drug would have a substantially equivalent therapeutic effect, even though it's not actually a therapeutic equivalent drug. So just to explain a little bit more what this is, we do have in our law a generic substitution requirement. If there is a generic, which is a therapeutic equivalent drug, pharmacist is already supposed to substitute that for a name brand drug. The name brand drug is prescribed unless the prescriber has indicated that they should dispense as written. But typically pharmacists don't have the ability to substitute another drug in the same class with a substantially equivalent therapeutic effect if it's not officially recognized as a substitute under a federal classification. So expands the authority. This was to respond to concerns about both the potential unavailability of some drugs and also the potential unavailability of some drug ingredients that would make it difficult for those drugs to be available. So again, in this case, the pharmacist would have to notify the prescriber of the actual drug dose and quantity dispensed as soon as reasonably possible. And this authority is currently valid through March 31st. The next section from Act 91, Section 12, allows a healthcare professional to authorize renewal of an existing buprenorphine prescription that's to treat substance use disorder without requiring an office visit. And this requirement or this provision is through March 31st. Section 13 from Act 91 allows the Agency of Human Services to reimburse Medicaid-funded long-term care facilities and other programs that provide 24-hour-a-day services for their bed hold days. Bed hold days is when one of these residential facilities is required to hold a resident's bed for them while they are in another setting, typically in a hospital. And this would require or allow AHS to reimburse them for holding the bed for those bed hold days. Typically, they do not get paid if the resident is not there. This authority is through March 31st. Then we skip a few sections in the underlying Act 91 because they are provisions that were codified. So they are, they did not have an expiration date. They're in statute unless and until you change them. But Section 17, we're getting into some sections on healthcare professionals and trying to increase the potential provider availability for Vermont patients. So this section deems a healthcare professional who is licensed, certified, or registered to provide healthcare services in another U.S. jurisdiction, deems them as being licensed, certified, or registered to provide healthcare services to patients in Vermont, either using telehealth or as part of the staff of a licensed facility. If they're doing telehealth, that's it. They don't need to do anything else. But if they plan to provide services in Vermont as part of the staff of a licensed facility, then they have to submit to the Board of Medical Practice or the Office of Professional Regulation as applicable, their name, contact information, and where they will be practicing. And this provision is again through March 31st. The next section from Act 91 is Section 18. And this is for retired healthcare professionals. So the first part allows a former healthcare professional who retired from practice in Vermont not more than 3 years ago to provide healthcare services to patients in Vermont by telehealth or as part of the staff of a licensed facility after submitting to the Board of Medical Practice or OPR their name, contact information, and where they will be practicing. And it allows the Office of Professional Regulation and Board of Medical Practice to issue free of charge temporary licenses to former Vermont healthcare professionals who retired from practice here between 3 and 10 years ago. And for those people, it allows the Office of Professional Regulation or Board of Medical Practice as applicable to impose limitations on their scope of practice as appropriate. So somebody who's been out of the workforce longer, OPR or Board of Medical Practice may want to put some limitations on what they can do. And this again is through March 31st. Section 20 from Act 91 says if the director of the Office of Professional Regulation or the executive director of the Board of Medical Practice finds that their boards cannot reasonably, safely, and expeditiously convene a quorum, then the director of OPR or the executive director of the Board of Medical Practice may exercise the full powers and authorities of their respective boards, including taking disciplinary authority. And the records of any actions that they took under this authority would need to be posted on the website of the relevant regulatory board. And this is through March 31st. Section 21 from Act 91 allows the director of OPR and the commissioner of health to issue orders governing regulatory professional activities and practices as needed to protect public health, safety, and welfare. And this is also through March 31st. Then we move into some different provisions. So Section 22 from Act 91 specified that it is not the emergency involuntary procedure of seclusion if a voluntary patient or an involuntary patient who is in the care and custody of the Commissioner of Mental Health is placed in quarantine if the patient has been exposed to COVID-19 or in isolation if the patient has tested positive for COVID-19. And similarly, it is not seclusion for a child in a residential treatment facility to be placed in quarantine if the child had been exposed to COVID-19 or in isolation if the child had tested positive for COVID-19. These provisions were not time limited in the legislation, but they are specific to COVID-19 exposure or a positive COVID-19 test. So in that sense, they are limited to COVID-19. Then we skip a number of sections in Act 91. Again, these are telehealth and telemedicine, specifically telemedicine provisions that were codified. But Section 26 allows for the waiver of telehealth requirements relating to HIPAA compliant computer internet connections if it's not practicable to use such a connection under the circumstances, and for waiver of informed consent requirements for telehealth if it's not practicable to obtain or document informed consent under the circumstances. And this was changed in Act 140 to be through March 31st of 2021. And I should mention as well that it's under both state and federal law that typically telehealth has to be performed using a HIPAA compliant connection. The federal government is using enforcement discretion to not enforce that requirement during the pandemic. And so this provision was restricted in that piece to what is permitted under federal law. So as long as the federal government is continuing the enforcement discretion, Vermont is able to waive that as well. Then we have a couple of sections that were not in Act 91, they were just in Act 140. So the first says that a board or profession attached to the Office of Professional Regulation, so this is actually broader than just healthcare, may issue a temporary license to a graduate of an approved education program if the licensing exam that's required for that profession is not reasonably available. As you've probably heard, there are a number of exams that have been delayed or canceled right now in response to the pandemic. And this is through March 31st. It also allows, in the next section, the Board of Medical Practice or its executive director to issue to an individual licensed as a physician, physician assistant, or podiatrist in another jurisdiction, a temporary license to practice in Vermont until not later than April 1st. It also allows the Board of Medical Practice or its executive director to waive supervision and scope of practice requirements for physician assistants, and it allows them to impose limitations or conditions if granting that kind of a waiver. And those are through March 31st. And I believe that is it. So we got through the whole thing.
Terrific. Yeah, no, thank you. I thought it would be good to keep going. It looked like everyone was just listening, and we'll get to questions on this, and we're probably going to have some testimony along the way. So the key here for us is that many of these things end March 31st, and so we're under the little bit of a time crunch to determine how long or if to extend them. So we may as well do everything at once, including the June deadlines. That's why we're meeting with House Healthcare. So it'll be a joint decision-making process along the way somehow. Any questions for Jen? You're lucky. Oh, Ruth Hardy. There you go.
Jen, you may not know this information, so this might be something we need to get from the relevant departments, but I'm just curious how frequently some of these waivers were used, particularly around like the professional coming back into practice, the OPR stuff, and yeah, just in general, how often they were used as a sort of sense for us of how urgent it is that we extend them and for how long. It seems to me that most of them should be extended, but the question is how long and how urgent are they?
Great question. Yes, and I don't know how frequently that flexibility was used, but I think we will probably be hearing from some of those folks next week. And
we will
provide that information.
Okay, good question. Any other questions? All right, thank you. Nellie, why don't we go off of YouTube for a minute and then we'll scoot